Hello, my name is Terry Armstrong, and I'm an Associate Professor of Nursing at the University of Texas and Associate Professor in the Department of Neuro-Oncology at MD Anderson. I'm happy to be joined today by Dr. Mark Gilbert, Professor in Neuro-Oncology at MD Anderson and Principal Investigator of CERN, and Dr. Diane Harricauer of the CERN Foundation. Welcome to you both.
Thank you.
Let's get started with a discussion of CERN. Diane, can you briefly describe the CERN and the mission of the CERN?
Sure. Well, CERN stands for Collaborative Ependymoma Research Network, and it was actually founded because we wanted to advance clinical treatments for those suffering with this disease. At the very beginning, when we started looking into this disease, it was realized that there was no new findings on it. It wasn't a disease that was common enough or large enough to have its own treatment regimen. A lot of it was extrapolated from other diseases, and we just felt that this wasn't right. This just wasn't the right thing. And so what could we do that would be positive for those suffering from ependymoma? And we came up with CERN. So it is taking the best and the brightest from across the United States as well as across the globe, of people who have a lot of energy and a lot of enthusiasm and technical talents beyond, to really focus on our mission, which is developing new treatments for those suffering from ependymoma, and hopefully one day leading to a cure. So those who suffer will never actually have a lack of positive outcome. We actually have the CERN Foundation divided into 5 programs, which I think, Mark, if you want to talk about the 5 programs?
Sure. So the 5 programs really break down into 2 core functions. And one core function is education and outreach. And I think, as Diane mentioned, it is not a very common disease. And as a consequence, even in the medical community, there's not a lot of knowledge. And so in a physician's career, they may not see many patients with ependymoma. But because of geographic distribution, they may see 1 or 2 or just a few. And so their ability to have that high-level knowledge will be limited. So I think one of the functions of CERN is to provide an educational resource for healthcare providers. And probably as important is to provide that type of resource to patients and patients' families. In addition, we have the core function of providing expertise through our website. Family members, healthcare professionals can contact CERN members and get state-of-the-art advice, and also, if appropriate, referral to a CERN Center of Excellence. That's one core function. The second core function is really, as Diane mentioned, finding new treatments. And to do that, we've created a series of programs. The center of that is really the clinical trials program, where we take new and innovative treatments and we actually test them in clinical trials. And to do that, we have actually engaged many of our colleagues across the country, Canada, and now we're expanding actually into Europe. And by doing that, we've handpicked centers that have outstanding clinical investigators, outstanding scientists, all working together for a common cause, and that's finding new treatment for ependymoma. Supporting that are more laboratory-based efforts. We have a program that's looking at tumor tissue and doing molecular and genetic analysis, trying to find clues as to what forms ependymoma and taking that one step further and trying to find therapeutic targets. We have groups that are actually looking at finding new drugs. One group is looking at the existing drugs, all that have been approved by the FDA, but now focusing on ependymoma and finding if there are drugs that are readily available that may have activity. And another group is actually trying to synthesize new drugs and specifically targeting some of these molecular pathways, some of these hopefully target points in ependymoma. And then we also have an outstanding group of scientists who are looking at the basic biology of ependymoma. Why do they form? What happens? What causes them? And taking that knowledge and actually creating models in the laboratory that we can actually use to screen and test new drugs before we bring them into clinical trial. So really it's a collaborative effort. There's interdependency between each of the program areas. The clinical trials group provides tumor tissue to the molecular pathologists so they can help us correlate patient response with molecular changes. We have our drug development group, and they are using information from the molecular pathologists and then testing their new treatment regimens in the group that is developing new animal models and laboratory models. So everything is all working together with the ultimate goal of finding new and better treatments, and as Diane mentioned, hopefully one day a cure for this disease.
You mentioned about the rarity of the diagnosis, and it seems like it's been very difficult to find funding or be able to do clinical trials for treatment. How is CERN positioned to answer these questions?
So what CERN has done with the very generous support from philanthropy is brought together some of the top clinical and laboratory investigators in the area of brain tumors, and has given them the support to allow them to focus their creativity and their energy on a disease which is uncommon and hasn't garnered the type of interest from other funding sources such as the National Institutes of Health to allow us to really make those critical advances.
One thing that I think is really interesting about CERN is the fact that I look at it as a holistic position. And what I mean is not just focus on the basic research and not just focus on the clinical side, but it's also focused on the patient and families and the success factors in that area. So the holistic approach, I think, makes CERN Foundation something that is quite unique, and the fact that it has collaborations from people who normally wouldn't talk to each other. And we don't do things sequentially. We do it in parallel, almost a fast track to try to find a cure for this disease. So it's just been a blessing working with these talented individuals and knowing that we're going to accomplish greatness when it comes to fighting this disease.
Thank you for those great comments, Diane. One additional point, and it's very unique to CERN, is that it represents the collaboration between pediatric and adult investigators all focused on the same disease.
This has been a fantastic introduction to CERN. I'd like to thank you both for taking the time to be with us today. Thank you.
Thank you.